Welcome back, my dears. Welcome back, another part of our work. Welcome back, another part of our work, and we will deal now with the points that's very important for the PSW and the ethics. The ethics and the PSW. So what about the personal support worker and the ethics criteria, ethic principles he should follow while he's working on this job? Healthcare ethics, like we say here, healthcare ethics encompass the fundamentals principles, like here, the fundamentals principles, guiding moral conduct in the medical field. So healthcare ethics must be there in the medical field. They help determining what is right and what's wrong. Usually the ethics is telling me what I should do and what I should not do. This is the norms of the ethics. So it's important, the ethics. Ensure the fair, respectful, and dignity of the patient's care. So also, we have things, when we talk about the ethics, we talk about stakeholders. We talk about the others like healthcare professionals. And if we talk about the malpractices, we talk about the misconducting and negligence. All this is related to the ethics as well. So let's say now, what are these ethics principles? What are the ethic principles that PSW should believe that it should be there while he's working with the PSW? The first thing is autonomy. Autonomy is respects of the patient's rights to make their own choice. So as example, we do this usually when we are working as PSWs, when we bring as example the two types of food, beef or fish or chicken or fish, and we say, would you like chicken or would you like fish? Or any other things, like as example, shall you drink this kind of juice or shall you drink this kind of juice? Which color you would prefer to wear when you start the day and so on. Application for support workers. Support workers should ensure the patients have all the necessary information to make their own decisions. Yes, because any decision is based on the information. So give the information to the patient so that he can make the right decision. They should respect patients' choices and support their independencies, even if they disagree with the decision made. So I don't enforce as a PSW. I don't enforce my opinion or make the decision myself. No, I should encourage the people by giving them real information so that help them to make their own decision. The rights of the patient to have full information so that he can make a right decision. Example, if the patient refuses a certain treatment, the support worker should respect this choice and honor the patient decision. But wait a minute. If the patient refused treatment or whatever, in that case, this is a treatment anyhow, and giving the prescriptions and so on. This is the responsibility of the nurse. But sometimes if a PSW is involved in such a situation, especially who are working in home care or who are working in residences, these people there, they take medications in time. So as example, if he refuses or she refuses to take the medication in time due to any reason, maybe confused or having dementia or whatever, and it is then in that case, that should be reported on the spot into the nurse. Should be reported on the spot into the nurse. Okay. Beneficence. The second thing, so first thing we said on the principles of ethics, the autonomy. The autonomy is the first ethical principle that PSW should believe in while he work with the patients. The second thing is autonomy. What about the autonomy? Respect for the patient's rights to make their own decisions. This is the autonomy. The first one, which we'll talk about, is to respect the patients to make their own decision. Second point is beneficence. Beneficence is the obligation is to act in the patient's best interest. So I should benefit my patient. I should care about my patient and benefit him however I can to the most extreme extent. Because I'm there for the patient's comfortable and satisfaction and to help him whatever I can. So I have to be there also to maximize his benefits. This principle, we call it beneficence. Like here, I put it in red, we call it beneficence. Okay. Application for support workers. Support workers should provide compassionate and competent care, always aiming to improve the patient's health and quality of life. This is including performing tasks with diligence and advocating for the patient's needs as well. A support worker might spend extra time with lonely patient because most of the time he's sitting with the patient, engaging in conversation or activities that uplift the patient's spirits, promoting their mental well. So he has to be helpful to the patient. He has to satisfy the needs of the patient, like as example, feeling loneliness and so on. He must feel with passionate with the patient. Okay, so this was the beneficence, the second thing. Third, non-maleficence. Efficiency from efficiency, non-maleficence or non-maleficence. Here, duty. I have to do the duty with no harm to the patient. I have to do the duties with no harm to the patient. Maleficence, like you see here, maleficence from efficiency and the opposite of it, not with, it must be with very, very effective way to give your service as PSW. You have to prevent harm for your client. You have to prevent the harm for your client. You should not be a reason to harm or hurt your client or your patient. So here, application for support workers should follow proper procedures and protocols to avoid causing harm to the patients. This includes being vigilant about safety. He must care about the safety of the client, reporting any hazards or any incidents, and adhering the best practices in the care delivery. Example, like what? Here is an example. A support worker ensures that the patient's bed rails are up to prevent falls. So the bed rails, which is on the sides, the side rails on both the sides. So the PSW must make sure that these bed rails are up. They are not down, so that to make sure that the patient will not fall from the bed. To make sure that the patient will not fall from the bed. A bed rail are up to prevent falls and checks the medical equipments in functioning as well. The next principle, this is non-efficiency, means to do my work as it's supposed to be without negligence and with efficient as much as possible. The next point is the justice. Justice means that you will give the service to all the clients on the same. You don't favor one of your patients more than the other. As example, not because I am from Egypt or that I will check or favor the Egyptian patients and give them more care than the others. No, I should have to give care to all the patients same as each other. No any kind of distinction or so on. Fair and equitable treatment of all the patients, ensuring that resources are distributed fairly. Application for support workers. Support workers should treat all patients with equality and fairness. Without discrimination, they should advocate for equal access to care and resources for all patients, regardless of their backgrounds or circumstances. So, regardless of the circumstances or the backgrounds of a client, they should care. Example, a support worker ensures that every patient in a group home receives the same level of care like the others. So the justice means I'm treating all the patients same thing. Confidentially, let me here just remove this. Okay. Confidentially means I have to keep the privacy of my client. I have to keep the privacy of, and this is very important ethical principle. I have to keep the privacy of my client. Uh, this privacy, like privacy of information, is privacy of work, things that is related to his sickness or his personal data or his personal information, because the personal support worker works all the time with the patient and he's there in front of the patient, sitting in front of the patient all time long. Application for support workers must maintain the confidentiality of all patients' information. They should not share patient details with unauthorized individuals and follow protocols for securing, handling, or storing sensitive information. As example, here we have a support worker does not discuss patient's medical condition with friends and even with his family members, even unless it's required, unless it's required. So he doesn't have to say his secrets into anyone around them without the patient's explicit consent. So I have to take the patient's consent first. Do you agree that I tell them blah, blah, blah about you, something about you as a patient? Do you agree that I will tell them, so I give them some information about you or what? Yes, yes, no, no. No means you don't have to say his secrets into the others, thereby protecting the patient's privacy. So this is the meaning of confidentiality. Confidential means private means very important, not to be shown, not to be shown up, or to be reviewed by any other one. Only the people who are interested in or who are the targeted have to see it. Confidential means keep the secrets and keep the information. Keep the secrets and keep the information. So this was about the confidentiality. So again, after this, we have the fidelity. What is the fidelity, guys? What do we mean by fidelity? And this is also one thing of the most important things. Fidelity is the duty to be loyal, honest, duty of care. It's fidelity here is a duty of care and trustworthy in all professional relationships. Also, the relationship must be professional, but at the same time, it shows the love to the patient. It shows the loyalty to the patient. It's so that you treat the patient honestly. Okay, applications for support worker. Support workers should build trust with patients, like you see here, should build trust with patients by being reliable. Reliable means that the patients can trust them and depend on them, rely on them. Reliable, they rely on them or trust them. Examples, if a support worker promises to bring a patient's specific item or assist with an activity, they should ensure they follow through, thereby building trust and demonstrating reliability as well. Here, so now let us go back and see the pages which we talk about regarding the healthcare ethic principles, the healthcare ethic principles. I will put a question here right now for here for this, the healthcare ethic principle. And here it is. I will just put it here. new slides. Then we will say here, just 1 second, guys. Sorry about that. Here we go for the design and here. And let's see here. Sorry about that. We'll say discuss. Discuss what? Healthcare ethic principles. Then I want you as a personal support worker to give examples of your own. Give examples of your own about the ethics principles. The question is, like we said here, is about the ethics principles. I will show you here. We are talking about the ethics principles. Probably those are the ethics principles which we talk about. The ethics principles which we talk about. And I'll stay here like around 5 minutes to get your answer, guys. I will stay here to get your answer for 5 minutes. Just answer these questions inside your notebook. Discuss the healthcare ethic principles. Give examples of your own. Discuss the healthcare ethic principles and give examples of your own. Type. Just to remind you quickly, what is the answer of this question here? These are the ethics, the healthcare principles, ethic, the first of all. We said the autonomy, which means autonomy means giving the client the right, or giving the patient the right to make his choice and make his decision. Do not affect him. And I told you, if you are working in a hospital as a PSW or on home care or retirement residence, then when the time comes for lunch, you ask him, this, you want beef or you want fish, you want 7-Up or you want Pepsi, you want this, you want that, then he has to make his choice. This, we call it the autonomy. The second principle is the beneficence, means that you are maximizing his benefit. You are working in favor of the benefits and the satisfaction and the happiness of the patient. So you devote all your efforts to make him happy, to help him, to make him benefit to the extreme extent. The third thing is, here we go, is the justice, which means that you treat all the patients, you as a PSW have to treat all the patients in the same way. Not because I'm Egyptian, that if I find Egyptian case or Egyptian patient, that I will focus or give him more care than I give another patient. In that case, I will not have ethic principles. No. Justice, there must be equality or like equity for everyone. Equitable treatment for everyone. Equitable treatment for everyone. After this, we have confidentiality. Confidentiality, we said, from confidential, which mean the private. Keep the secrets of your client or patient. Keep it as secret. Do not say it to anyone. Do not take and public his own private information. Do not get use of his private information and so on. And finally, the fidelity, which means that you as a PSW has to be loyal to your client or your patient. You have to be very close to him. You are the one who sits with you as a PSW, and the one who sits with the client for more and more hours. And your shift from the start, either it was 8 shifts or 12 hours shift, you are sitting with the client. You are not doing anything except sitting with the client. For that reason, you have to show the care. You have to show the love and the passionate to your client. That was the ethical principles. That was the ethical principles, which I put here, the ethical principles. And I will leave you just, if you want to Google search, find more things to write down and write all these inside your notes. So we are talking about the healthcare ethic principles. healthcare ethic principles. Remember, this topic is related to the code of conduct and is also related to, as long as I have positive healthcare principles and I have ethic principles, that means there will be no malfunction and there will be no negligence. Everything would be nice. Shall leave you here around 5 minutes to gather the answers of this question, then we will go to another part.